Hello class, my name is Morgan. My presentation is on pneumonia. Looked at NIH, Britannica Encyclopedia, and Healthline for the information. NIH defines pneumonia as an umbrella term for infection of the lung parenchyma, or the functional tissue of the lung. So with it being an umbrella term, there are a lot of different classifications for pneumonia, and the ones on NIH at least follow the American Thoracic Society. So your classifications, you have community-acquired pneumonia, which is any pneumonia developed outside of the hospital setting. And then hospital-acquired pneumonia is pneumonia developed after being hospitalized for 48 hours or more. And then ventilator-associated pneumonia is pneumonia developed after 48 hours of being intubated. And what this tells the physician treating you is what the likely culprits of the pneumonia are, and if they're going to be more likely to be resistant to antibiotics, and it gauges how invasive and aggressive they're going to get with their treatments. As far as what causes the pneumonia itself, you have bacterial causes like streptococcus, staphylococcus. You have viral causes, and there's really no consensus as to whether the viruses cause the pneumonia themselves or if it weakens the immune system to allow a secondary bacterial infection. But the viruses that are usually implicated are influenza, parainfluenza, RSV, and adenoviruses. The last classification they'll use is what part of the lung is being affected. So you have bronchial pneumonia, and just in the bronchi and bronchioles still, but when these are left untreated, it can develop into the lobar pneumonia, which is the more severe consolidation of an entire lobe of a lung. And from there, you've got 4 separate stages that pneumonia goes through. The first stage is the consolidation, with the congestion and the fluid filling around the alveoli and just all that inflammation and gunk. And you'll start seeing a lot more symptoms of pneumonia with shortness of breath, and fast heart rates, fast breathing, low oxygenation, stuff like that. Start getting fevers. And then you'll move into a red hepatization of the lung tissue. Under a microscope, it looks like liver tissue, so that's why they call it hepaticized. But this is a fibrous buildup. Your immune system is building up fibers around the alveoli to try and fight off the infection, and this is reducing any gas exchange in those alveoli. So they're not functioning pretty much at all at this point. Move on into the gray hepatization, where red blood cells are being broke down. All the different macrophages and stuff are coming in and trying to fight the infection. And if you fight it off successfully, you'll move into the what do they call it? Resolution, I think, phase, where your body's fought off the infection and now it's just cleaning up all the gunk so that you can start getting your lung function back. At this point, depending on how severe your infection was, you may or may not have scar tissue left over. What I found kind of interesting looking at all of this was what criteria do they use to see if you need to be hospitalized. You come in with your community-acquired pneumonia. What tells the doctor that you need to be in the hospital? So they use something called CURB 65 as their grading criteria. So C is confusion. Is the patient confused? Is their mental function being affected by the infection or the lack of oxygen? Uremia for the U. So they'll do blood work. If your BUN is greater than 20, I think, is the defining line. And then the R is respiratory. How hard are you working to breathe? So greater than 30 times a minute was the criteria they gave. The B stands for blood pressure. So is your systolic blood pressure lower than 90, or is your diastolic blood pressure lower than 60? And then the 65 is just age. Are you 65 or older? And with that, they'll grade you 1 point for each item. And if you're a 0 to 1, you get outpatient treatment, and they'll send you home with antibiotics, maybe an inhaler. But a 2 to 3 gets you admitted to the hospital, to like med surg or general ward. And then anything greater than a 4 gets you admitted to the ICU. So I hope that was helpful.